I hated myself. I loathed myself. I couldn't stand being in my skin. How could someone that's so blessed think that that's a rational option? To find peace, really, in the thought of ending my life.
Mental illness is much more common than people understand, and yet for centuries it's been shrouded in stigma. In mental health, the challenge is as big as they come in terms of its economic impact. It is bigger than cancer, diabetes, and chronic respiratory diseases combined.
Where we've got to in mental health is we've had some improvements. What we haven't done is innovated in the social space. We haven't said, what do you need to do in society to promote health and to prevent mental illness?
1 in 5 Canadians are impacted by it, and it's important that we work together as well on this initiative. The key is innovation.
IAM will bring together innovators, entrepreneurs, and people with lived experience to collaborate together and make those changes in mental health.
We've been able to see that when individuals go back and use the bike around and revisit places that are meaningful to them, oftentimes we witness elevated mood and emotional state, reduced anxiety, reduced and aggressive behaviors for individuals with more severe forms of Alzheimer's. We're also able to see individuals being able to recall memories with very vivid details associated with those particular destinations.
Connecting Minds really leverages technology, which is great because it's accessible, but it also provides a non-stigmatizing space. Imagine having access at your fingertips to someone or something that you're able to connect with instantly. And they would be able to not just coach you through the situation, but also hold your hand through the system and also be able to find you the right resource that was not only relevant to you maybe as a young caregiver, but to your family member as well. It's not just driven by lived experience, but it's led by lived experience.
I get excited by the idea that rather than leaving the knowledge of the majority of the population out of the equation when thinking of solutions, an institute like IAM is going to try and pull that in and say, who's got the best knowledge? How are we going to use it?
This is a great initiative that's going to tackle a very important issue.
This is going to be a convergence of new discovery in neuroscience and immunology, genomics, and in technology that is unlike anything that's come before. This is our own moonshot for inner space.
We've gone to the edge of the diving board and we know something different needs to happen, and we're afraid to take that plunge. IAM will take that plunge.